Imagine going through a traumatic event, but instead of it becoming just a memory of the past, it keeps alive in your mind. Every single day, every single moment. You try to sleep, but the same terrifying incident plays out in your dreams again and again. A door slams loudly, and suddenly your heart starts racing, as if something bad is about to happen again. This isn't just post-shock anxiety. It's a mental prison where your brain forces you to relive those painful moments repeatedly. Today, we are going to deeply understand post-traumatic stress disorder, PTSD, and learn how to overcome it, all in this video. Post-traumatic stress disorder is a mental health condition that can develop after experiencing a major trauma or frightening event, such as an accident, war, physical or emotional abuse, or any shocking incident that deeply shakes a person from within. According to the DSM-5, Diagnostic and Statistical Manual of Mental Disorders, 5th edition, if these symptoms last for more than a month and negatively impact a person's daily life, it is diagnosed as PTSD or post-traumatic stress disorder. There's another term often associated with PTSD, that is acute stress disorder. The major difference between the two lies in the duration of symptoms. If the effects of trauma appear from 3 to up to 1 month, it is termed ASD or acute stress disorder. However, if the symptoms persist beyond a month, doctors consider it as PTSD and treat it accordingly. If we talk about data, PTSD is a serious mental health problem in the United States that affects different people at different levels. Around 6.8% of American adults experience PTSD at some point in their lives. And this condition is seen more commonly in women compared to men. Due to stress of war, PTSD is more common in the military. For example, among Iraq and Afghanistan military veterans, the PTSD rate was between 11 to 20%. In Vietnam military veterans, this rate changed from 15 to 30%. From this, you can imagine how high the risk can be. PTSD is not limited to soldiers, but anyone who has gone through a major trauma can be affected by it. Now let's talk about how we can recognize its symptoms. PTSD symptoms fall into 4 categories. They are intrusive thoughts, avoidance, changes in mood and thinking, and being excessively alert, also known as hyperarousal. Let's understand them one by one. First is intrusive symptoms. In PTSD, a person is repeatedly disturbed by memories of past trauma, scary dreams, sudden flashbacks, and re-experiencing traumatic events without any clear reason. These are common symptoms of PTSD. It happens suddenly, and the person feels as if they are back in the same situation again. Here, I want to give you an example that I've seen in my clinic where patients come to me and they talk about when, for no reason, or sometimes there's a trigger, they relive the whole life that they've gone through trauma, just like it happened yesterday. And thing that we see in PTSD is avoidance symptoms. People going through PTSD try to avoid places, people, or situations that remind them of the trauma. Sometimes they even distance themselves from their family and friends. This negatively impacts their relationship and social life. I've seen this in multiple times where patients come in and they used to have friends and they no longer want to socialize with any of their friends or family members. They avoid any social gathering, could be a family gathering, holidays, and they just isolate themselves in their house, in their room. Third symptoms is we see negative mood and cognition changes. People with PTSD often feel guilt, shame, and emotional numbness. They find it difficult to feel happy or positive, which can further damage their mental health. Fourth is hyperarousal symptoms. In PTSD, the brain remains in an alert mode, leading to strong reactions to even minor triggers. Common symptoms include insomnia, trouble concentrating, being easily startled by loud noises, and increased irritability. I don't know how many times I've heard patients have told me if 4th of July is very difficult for them. That's when they hear all these loud noises, crackers, and it feels like they're back in the war or in their same in the trauma they were in. To identify PTSD, the first step is a clinical interview where the doctor tries to understand the patient's feelings and symptoms. After that, the PTSD checklist is used, which helps assess the severity of the symptoms through a scoring system. Additionally, mental health experts diagnose PTSD based on the DSM 5 criteria, focusing on the four key symptom categories. If you or someone else close to you is experiencing these symptoms, it's important to seek professional help as soon as possible. There can be many causes and risk factors behind PTSD. The most common is a traumatic experience, which we have already discussed, along with other contributing factors. So there's some other factors that I want to talk about that are like genetic factors. In genetic and biological predisposition is one of the big factors. If there's some family history of depression, anxiety, or other mental health issues, the risk of developing PTSD becomes higher. Research suggests that genetic factors may account for 30 to 40% of the risk of PTSD. More specifically, I want to talk about the specific areas of the brains, like hippocampus and amygdala. The amygdala is the part of the brain that controls fear and emotional responses. And in people with PTSD, it becomes hyperactive, leading to heightened emotional reactions. On the other hand, the hippocampus is responsible for storing and processing memories. In individuals with PTSD, the hippocampus tends to be smaller, making traumatic memories feel more intense and overpowering. So, as you can see, from these brain centers, we learn. So, PTSD is not caused by just one factor, it's the result of multiple influences working together. The good news is, with the right treatment and support, it can be managed. I hope this gives you a clear understanding of PTSD. But now the big question is, how can it be treated? What are the available treatment options? While both therapy and medication are available, the primary treatment for PTSD is psychotherapy, also known as talk therapy. In psychotherapy, common approaches include CBT or cognitive behavioral therapy. This therapy helps individuals recognize negative thinking patterns and replace them with more positive and realistic thoughts. It has been shown to significantly reduce PTSD symptoms. Research suggests that CBT is effective for 50 to 80% of people with PTSD. EMDR, eye movement desensitization and reprocessing. This technique involves specific eye movements, gentle tapping, or sounds to help the brain process traumatic memories. It allows the brain to reinterpret those painful memories in a less distressing way, reducing their emotional impact over time. After therapy, the next option is medication. To reduce PTSD symptoms, doctors may prescribe certain medications. However, taking any medication without professional consultation can be dangerous. Since every individual's symptoms are different, it is important to consult a mental health expert for the right medication and dosage. In addition to therapy and medication, there are some alternative options as well. Yoga and mindfulness. Practices like yoga, deep breathing, and mindfulness techniques can help restore emotional balance and reduce stress in PTSD patients. Virtual reality therapy. This is especially helpful for war veterans and accident survivors. A simulated virtual world is created along the patient to gradually face their trauma, helping the brain reprocess those events in a healthier way. While starting the treatment through therapy and medication is essential, that alone is not always enough. To fully recover from PTSD, emotional support and healthy daily habits also play a crucial role. The most important part of healing is having support, whether from a family or a support group where you can connect with others who have had similar experiences. In my clinical practice, what I have seen, also just to treat anxiety, we've used TMS, which is and ketamine, which is transcranial magnetic stimulation and ketamine therapy. Although these treatments are not FDA approved for PTSD, we've not specifically used to treat PTSD symptoms, but what we have seen when we're treating using EMDR, or sorry, using transcranial medical stimulation, we have seen significant improvement when we treat depression along with anxiety. So some patients that do come to us with depression and anxiety, so we see that not only the depression improves, the anxiety improves. Hopefully in the future we'll have FDA approved for PTSD also. Conclusion, PTSD is not just a common issue, it's a deep mental health condition. But the good news is it is treatable with the right therapy at the right time. Along with the support from family and friends, anyone can recover from PTSD and regain a normal life. If you or someone close to you is experiencing symptoms of PTSD, don't stay silent. Seek professional help. Remember, you're not alone in this battle.